So one more time, we start working on lateral line, how important this line is. We gonna talk about this hour and a half. So lateral line, if we just memorize about what's the lateral kinetic line? It's a chain of muscle, tendons, and fascia running where? From our foot on our side all the way up to our skull. And the most function for this line, it's a side bending, so lateral flexion, and balancing side to side movements. Also, it's a stabilize on one leg, standing, and controlling rotation, rotation movements, rotated. So how important is that? It's very important because all the time you can see the customers come in like this, leaning one shoulder higher than another, and they always complain, hey, my shoulder is stuck, my shoulder is in pain. And what you're doing, you just try to work on that shoulder and nothing changed. 2 weeks later, he's come back and he's still the same. Why? Because we have to treat the whole kinetic line and not just the one group of muscle. That's why we do testing, we do a postural assessment. We want to find out what's going on with this person and of course help him out. We don't want this person to come back with the same problem and waste our time, because we are manual therapists. We want you guys to feel good, to movements, pain-free movements. Under our foot, right in here, go around lateral aspect of our foot and go to the peroneus muscle. Let me get that little tissue because I feel I got allergy.
It's here.
Oh, it's here? Perfect. Yep. Someone burning something, and of course I got allergy right away. That's how it is. All right, so we got this peroneus muscle. After, it's going right in this fibula-tibial joints and ligaments and tendons, and jump right on that IT band, because that's why a lot of people get that pain on the side of the knee, because the whole kinetic line being compromised. We're going to do some postural assessment, and you'll see what I'm talking about, especially with scoliosis. If someone has scoliosis, that's the one, trust me. Those kinetic line is being compromised, and it's go all the way up in here. It's split in a Y. It's like a Y ladder, so it's coming on IT band and split here on our tensor fascia lata in the front, and in the back it's a gluteus medius and a gluteus minimus. So sometimes when people lay down on the side, when you work on that gluteus, all your phones will be on the left. Yeah, this is me. So, and people, like I said, think it's a trapezius muscle, elevator scapula is tight, and they just work on that. The person might be dropped a little bit, but they never change anything. Why? Because this side is holding me. Side is holding me. I need to release that to drop that shoulder down. You see, it's not my trapezius on my right side. It's maybe that's right in here. That's why we treated the whole line. And if this line is contracted, what I'm doing up here, I'm working on that side, right? I do manual therapy. And if this is overstretched, what I'm doing, yes, I'm do the bands work. I do the bands. I'm give my customer band. That's why if sometimes people come for massage, and you guys, you just do stretch this side more, do some manual therapy more on that side, and create more problem, more instability. Because if you work possible, try to not break. There we go, and rotate to the other side. And okay, so it's actually have to be 110 degrees. If you look at this right in here, it have to be 110. So she actually passed, but she said this side is a little bit restricted. It is actually. So yeah, don't do it. So this is the simple test. It's already telling me something going on that side, right? Mm-hmm. So now what I'm gonna do, I'm gonna ask her to bend forward. So she's gonna place her hands together and kind of lean forward. What I'm seeing here, if any rotation in the spine. So bend forward, head forward, coming first, and she's bent forward. So what I'm looking here, I'm just looking that Nice rounded. Yeah, she's very flexible, but what I'm see, this wall is pumping up kind of, and that's is, come back. Is any pain? I'm not gonna ask because yeah, she's really flexible. She do all those classes, but we're gonna do some side testing, see how she's gonna do it. Okay, yeah. So and let me see one more test. Remember the single leg stance. Go ahead, raise this up and stand. See how this any hip is changing. 1, 2. You calculate till 10 probably. 3, 4, 5, 6, 7. Pretty good. It's pretty strong. Switch side. She's not bad. There we go. You see, this one is more shaky. Yeah, you feel this one more? Exactly. So ask question because she's a practice with all those stability balls with exercise. She's a pretty healthy person, so it's hard on her to identify those problems. But some people like whoa right away, and that's gonna shows up right away. So what we did sides. So this is limited eversion and eversion. Yes, inversion and eversion, both. And ask her sometimes resist me. So pull. You see, this is what I'm doing. This is my movements. I'm opening this up. Yeah, and ask her to rotate back so she resists me and let it go. And I get more. Try to relax your leg. If she's trying to help me, I place something like right in here. You can place the pillow, bolster, so she's not gonna help you. And she's not gonna compensate. That's what I mean. Just like that. Here we go. On the top. This one is sliding off, and you see she's relaxing. Now she's more relaxed. Before, she tried to hold it. How's it feel? Good. Again, switch. Now here, you see, cross arms is straight, and rotate it. Guarding everything. She's control everything. Make sure your client is trust you and not doing all that stuff because you're going to work hard. And just place that right on that hip. Get that gluteus, and I'm start step. You see, I'm moving my butt. I'm moving my hip. I already showed this exercise many times. You work that way. How's it feel? Ask her to resist. Ask her to push against me. She's reactivated again. Good. Next one. Good. Also, you can work on those iliacus muscle. You can grab that hip, working on iliacus. Also, tensor fascia lata right in here. Same thing. You can do movements. If you need more, you step here. You more and more and more. And I go right in here. Keep going. How's it feel? Good. And relax. Next one. It's like I said, so many variation. I see a lot of people do cross the X. They grab that hip, they pull that hip, they grab that fascia and start pulling in a costile, all the serratus muscles and start pulling. She's breathing, and she also can bring this elbow towards me. And away. I'm holding this arm like a tuning fork. Why? Right, see here. On that. I pull that shoulder down. I open that area for me. And what I'm doing, I'm working that scalenes muscle. And I just drag that fascia all the way up behind the ear. So you see my hands is straight. So I go dragging and pulling down. And it's a bunch of stuff, like I said, in this position. You can work a lot of things. You can work on that shoulder. You can work on that lower back. Exactly. And guess what? You can do in front. You can do in the back. Do you know how to do in the front? I'll show it to you. But you're doing right. So that's this way. Look and look. So this is what I like. This is unique. You hold that way and stretch. Boom, boom, boom. Now she's grab you right in here and you pull on the side. Look at that. And you can work on that scapula. You can drag that down. Look at that. Push down. Push this elbow. This way. I'll show the customers all the time. This way. Push down. Let it go. Don't push so hard. Here we go. You feel that? Boom. That was crack in her, pop in her shoulder and in her elbow. We fixed something. That's great. All right. Go ahead. Sorry. Let's finish this. Yes. Scapular and scalenes. Yeah. Show me how you work.
I keep my fingers flat and I work and I can feel them all right here.
Perfect. Like I said, it doesn't matter.
I warm them up and I can feel it right here.
Yes.
Is that okay?
Mm-hmm. Great. So scalenes and sternocleidomastoid here. Remember that X and that neck is always tilted.
You can feel where the tight fibers are right here.
Perfect.
Find it all.
Like I said, it's no right or wrong. If you know what muscle to work, how to work, you just apply and use it.
Now you do the claw.
Yeah, claw. Yeah. Grab that goddamn head and rip it off. That's all I need. God damn it. God damn it.
How do you do that?
Remember you hold one arm under, so you control. No, all the way down. You control it. There we go. You control it. Try to move. Try to move. Can you move that head? No. Yeah, you can flex this way and that way. Yeah. Now you see, yes, band, and that's the sternocleidomastoid right there. It just pops up, and you just grab it. Boom, and you move it. Move head. Control that head very gently. There we go. Look at that, beautiful. Up and down. Tuck the chin and extend. Flexion and extension of the neck. Here we go. Cervical flexion extension. Yeah, because she have a chain. I don't really like that chain. I always ask to remove.
I see.
Yeah. And you can snap out of it if you want. Just bring it up here and just snap it. I'm just kidding. Don't do it. Massage therapist, please don't start snapping people. Don't adjust it.
You go like this.
Yeah, like this. Here we go. Stay this way because you're going to be lean on it. Lean. And no oil. Here we go. Look at that beautiful thing. Yeah, slide down and up. I go all the way up here. Yeah. I'm just sliding down like this. Like a scooping up. And that's beauty.
Wow.
Exactly. We have to move it. Yeah. So come back here. And right in here. So let's see how you feel.
Good.
So let's do a little bit more tests, like lean to the side. Lean to that side. Look at that. Oh my gosh, you almost and go other way. Yeah. Hell yeah, it's more. That's good. How do you feel?
Good.
She's feel good. So we working on that. Let's see if we can restore that holding. She get up from the table, but we have to work maybe on the ankle stability. But she's doing. How do you feel? Better?
Good, yeah.
Exactly. So that's what we need to do. That focus on that breath and how's that spasming muscle. Relax. Let it go. I want to see it. And unbelievable. You feel that? It's no more spasming muscle, and that's our key. If you guys hear and someone work on just the shoulder because your shoulder is high, it's not going to do anything. So we work the whole kinetic line. We release, and look, she's more balanced now.
One side or both sides?
We do both sides, but you will feel it. You always do the notes. When you finish that massage, you always do soap notes, and after soap notes, you're going to say, that side it was more tender, more or weaker. So when you just write this down, when she's come back, you're working on the weak side. And remember that contracted side we work manually and also do some bands work. I will give her exercise against the wall. So stuff like this. Come over here. I will show it to you. You stay against the wall. Stay side position to the wall. Now, the leg is closer to the wall. Cross this way. Just like that. Cross it. Now, my arm, let me go this way. The closer to the wall, come right against the wall, and my top coming on the top, and I push myself this way. She's pushing this way. Here we go. Also, feet ball is great. You guys lay down on the feet ball. Yeah, you come train here. Cross. Push this against, like right here. Push it and pull. Look at this. And actually, you can work on here with her. You can just open this up. If you're a therapist, you can work. You can help her out. You can shift it. Or I can even put the band and try to distract her with the bands, which is going to kick the brain in and it start do this compensation, get that balance back. How do you feel? Okay. Also, lacrosse ball, standing leg, plank position, that's going to work on that kinetic line, lateral kinetic line, and stabilize that core. Also, balancing exercise. We've been talking about this many, many times. Single leg standing, bands, and rotation, all that stuff. All right. You guys have a good day. We'll see you next week. Bye-bye.